Hello and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I'm your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida, and I am joined by my co-host, the amazing and talented nurse practitioner, Hope Gulley.
Yay!
All right, so...
Awesome.
Episode 4?
Episode 4.
Wow, it's clicking along.
It is just going so quickly, I feel like.
And we're having a lot of fun.
We're having so much fun.
And the feedback is great.
It's been awesome.
Thank you to all the listeners for, sending us feedback about what you want to hear.
Yes. Thank you guys, truly.
Yeah, a lot of that's going to shape what we talk about.
For sure.
Excellent. So I think we're going to call this one What to Expect When You're Consulting.
Ooh, very nice.
Not what to expect when expecting,
yes,
but when consulting, because I think there's a lot of fear and lack of information, and people just want to know the process.
Yeah,
so,
absolutely.
I think one of the most important things is it starts with the phone call.
Right.
So people talk to Kimber, right?
Yes.
And Kimber's our patient care coordinator, and she's fantastic. And she kind of is able to get a lot of information at that time, like regarding where you're at, what you're doing, and then also figure out if now is the right time for you to come.
Exactly.
Right?
And I think that's a huge component too, is it's always that first touch. It's the person who, has all the answers to the questions, but it's a warm and inviting voice, which I think when we talk about a consult, especially when it comes to something as intensive as surgery or bringing concerns that, you may not talk about to anyone else besides us, it really takes that special touch to really bring you in.
Oh, definitely. And a lot of it is word of mouth. Like,
absolutely.
I think people say like, oh, it wasn't as bad as I thought. That's another thing. Like as they come in, they're like, it wasn't as bad as they thought. But for the people who are very nervous about coming in,
sure,
I think this is going to be a very helpful episode.
I do too.
So tell us, or kind of bring our listeners through, like when someone walks in, of what the process is.
Sure. So if you're coming to meet with us in regards to surgery, you'll be brought back by someone from our clinical team. So we really do try to shape on consult day and if you're a new patient with us, you're meeting the entire clinical team and everyone who's going to be, meeting with you, taking care of you after surgery, and who's going to be prepping you before. So a huge component of that is we go through, obviously, your medical history, very in depth, all of your current medications, and also even like things about you. Like we want to know about your family, we want to know about kiddos. We want to know like, how did you find us? And any kind of questions you have initially in the research that you've done. Because I've found a lot of our patients do a ton of research before, which is pretty awesome.
But you brought up a good point, because we want to know like what herbals you're on, what type of vitamins.
Everything.
And sometimes when you're filling out that thing online that we all fill out, like if we go to a doctor.
The portal,
we forget some things.
Totally.
And it happens. And like, it's not that we think our patients aren't being truthful. It's just that literally it happens that you don't remember.
I do it all the time. Yeah.
Totally. So I think
I do have that.
That's a big component. And, also going back, and you've heard me, if you guys listen to hear me talk before, it's please, if you're out of town and you don't come to see us, which we really want you to,
yes,
make sure you're going to see someone who's board certified by the American Board of Plastic Surgery.
Yeah.
I keep reiterating that. That's an important thing, because just because you go on plastic surgeon, or go on Google and type in plastic surgeon, what's in your area, we're not all built the same.
No.
And there's a whole big criteria on that. But I think we'll get into board certification another time, but that's kind of where you have to start.
Yeah.
And then look at obviously the Google reviews and everything.
Right.
But sorry for the digression, but let's get back to again. So the patient comes in, like you said, they're meeting with one of our clinical team. Yeah. And they're talking about, going over everything like that.
Everything.
Where do we go from there?
So from there, they get to meet you, the talent, as we say. So what I really love about our approach is it's very respectful to patients, which which sounds very like, yes, obviously that's the goal, but that isn't done everywhere. And so what we've kind of structured into your consult is they will meet you first and have a conversation with you, kind of get to know you and you get to know them before we have you change into a robe. I think that is so huge because it's so great for building confidence and building that connection. And I think it really does ease a lot of patients' discomfort too.
Absolutely. And, even if I'm going to visit a new doctor,
Oh, yeah.
I want to talk to them
For
first.
sure. Yeah.
Let alone if we're going to be looking at sensitive areas.
Definitely.
We try to create a rapport and make people feel comfortable because believe it or not, like for some of these patients, it's like the first time aside from their spouse,
Right.
their physician has
Definitely.
seen them. So building that rapport while while they have their clothes on, it's very important. And I think there's a big relief once they realize that that's the way it's going to be.
Absolutely.
And so I think that's an important thing because you don't get that everywhere. Sometimes, people try to like pack these consults in. That's the other thing.
Yes. We take
You
our
get
time.
like an hour or so.
Yeah.
And one of the nice feedback we've gotten is, oh my gosh, I didn't realize I was going to get to spend that much time with me or with you,
Right.
depending on what
Right.
the consult is, if
Totally.
it's an aesthetic consult with you.
Yeah.
So I think that's a really important thing of like the amount of face time.
I
Because
agree.
I don't want to feel rushed.
No.
I don't want
yeah.
them to feel rushed. And you really need to establish that rapport.
Definitely.
So, so like Hope said, we meet ahead of time and we talk about wishes, wants, hopes, dreams,
everything.
And a lot of times that's where we'll kind of start the process of what they're interested in.
Absolutely.
Yeah.
Yeah. And it's them being able to meet you and voice the concerns. Cause I think when it comes to like them voicing concerns to us, it's a little bit different, but when it's to the surgeon, some patients may clam up a little bit. So they'll always have another clinical staff member in the room as well. So we're there with you guys. And I think that that's great, but it's great for an opening of that conversation before the exam too.
Absolutely. And I think one of the other things is that people have a story.
Totally.
And
My favorite part. Yeah.
Someone might have went to another consult and had a very bad experience, and now they're all really have a lot of apprehension, or a family member has,
Sure.
or they've had surgery in the past with a negative experience. So I think that's really important, again, to find out where they're at. Get a litmus test of like, are you comfortable? Are you nervous?
Sure.
And so I think that's really important for us to kind of talk about that. And again, we've talked about this before. I'm not there. You're not there. We're not there to sell a surgery.
Never.
We're there to educate.
Yes.
Okay. And when you take that approach, we're able to, put you into the right, surgical procedure.
Right.
Or kind of create a treatment pattern that's going to fit you.
Right.
So I think that really, really is important.
Yeah. And I think that's what sets us apart is, I hear Madeline, our nurse, say it all the time. I know I say it too to new patients who are a little bit nervous or maybe even feel like the pressure almost, of like, do I have to book today? What's like, do I get a discount if I book today? And, all the fun things that you hear. But we always say today's a learning day. Today is the day where you get all the information and you get to talk to someone who's board certified, who's trained, who does this every day to learn.
Yeah.
And then go home and think about it. This is surgery. This is not something, which is why we take the medical history and everything into detail, because this is surgery. This is not something to.
And that's definitely,
play down.
something that I would call the common fears and misconceptions, which we'll get into a little bit, but let's not jump ahead too far, because the next step is we have them change, right?
Yes.
And then I'll come back in, we'll come back in always as a team, and we'll take some measurements depending on which areas we're talking about.
Sure.
Go over anatomical things. Again, this is also a good point to talk about like what we're thinking, what they're thinking.
Yeah.
Because a lot of times we'll have patients come in, they're like, I have no idea, whatever you think. Or patients will be like, I want this.
Yeah.
And this might actually not be the right thing for them. So it's good to kind of, again, start that conversation and really go through it.
Yeah. Have you found as like time has gone on, as like everyone's becoming more and more educated, especially our patients, that conversations had to shift for you a little bit, or not
definitely.
so much?
No, definitely. I mean, you always want to find out like where people are at, you know, but I think I have actually probably a better idea of directing the conversation so that I think, through the years of
Learning
doing
to
this and the
gauge
thousands of patients is sometimes picking up, quickly where, where people are at and really what their fears and concerns are.
Sure. I think something that you do very well, which I've learned as a provider from you, is the art of an efficient consult, but one that's very personable and very like not rush. Because you can tell, even like if you go to Chick-fil-A or, well, actually
Mm-hmm.
Chick-fil-A is a terrible example because they never make you feel rushed. But, there's like certain instances that all of us have had in our lives where someone we're getting a service from and they feel rushed, and therefore our experience is kind of different. So that's something that I think you do very well. If it's efficient, we're going over a ton of information. So what are some like tips and tricks, or if a patient's coming in and like, what would they expect in like a consult with you in regards to like the exam and everything too?
Well, again, let's go back a little bit. The first thing is finding where they're at, what their history is, of how long they've been thinking about this. Are they scared? Or do they have family members or friends that have had this surgery?
Right.
What have they found? Because a lot of times they're like, well, I was online, I was on Google or whatever. And I'm like, sometimes we have to unprogram or de-learn what they have because they have misinformation or bad information.
Sure. Yeah.
Unfortunately, with the large amount of information out there, it's not always good.
Right.
So that's why
Dr. Google,
Dr. Google,
Yeah.
and sometimes Dr. Google actually happens after our consultation.
Yes, usually.
Because then sometimes we'll do like
and
a second consultation.
Yeah.
They'll have questions like, I went home and I was on Google. I'm like, please don't.
Yes. Yeah. That's what we're here for.
There's a reason why I went to school forever to do this.
Yeah, exactly.
But I think one of the things you brought up again, which is super important, is just how to be thorough, but also be efficient, because there are patients, we have a number of patients to see in a day, but also with their time as well. I don't want to be wasting their time.
No,
because there
definitely.
are some patients, right, who are like, all right, come on, let's go.
Yeah.
I know what I want.
We got to go. Yeah.
And so gauging that is good too.
Yeah.
No one's going to be the same.
No.
And some people
That's
are going
the beauty of it.
And it's very interesting because it's this way with, a lot of different things. Some people want to know every little bit, every little detail.
Yeah.
And other people are like, I don't know, I'm good. I've been watching your Instagram for years and I'm ready to go. I don't need all the details.
Yeah.
My sister's had it. My friends had it.
Sure.
So those are kind of important. So, and then just coming up with the plan.
Yeah.
And then also telling them that again, let's go back to common fears and misconceptions.
Sure.
We don't have to decide everything today.
Yeah.
We'll have a chance to even change things. You can always do a second consult than you want. We can do a follow-up phone call, a virtual. So if there are some they're like, I don't know if I want an implant, maybe I don't want an implant. That's just an example. I'm like, think about it.
Right.
You don't have to decide today.
Yeah.
Today is, again, information day.
Yeah. It's learning day.
Yeah. The other thing is, it's always very helpful if you can bring in someone else with you.
Yes, I was going to say, that's like the biggest tip I can give any patient, and something that we always appreciate is a spouse or a friend or a sister or whoever comes with you. So why do you think that's helpful? Totally.
If even great, because a lot of times these people are actually the ones that are going to be taking care of them.
Yeah.
And it's also two sets of ears, right?
Yeah.
And so they can be able to talk with them and ask questions like, hey, what's the recovery going to be like?
Yeah.
And things like that.
Totally. And I think too, it's great to because even some patients, when they're nervous, they're not going to volunteer all the things. And how many times have we had a spouse or significant other or whatever be like, oh, well, this is what I hear every day. And these are the things that I know that she's passionate about and wanting to be here for. So it's really cool.
Cool. Yeah. So once we do all that, then I kind of step out and whoever's with me, whether it's you, one of our nurses or someone else helping me that day, we get all the photographs.
Yes.
And again, we try to do that in a most comfortable manner, which is a very uncomfortable process.
Sure.
But we try to make it as comfortable as possible.
You try to make it fun.
And it is also interesting through the journey. Some people initially when they come in, they almost barely want to open their robe.
Right.
But by the time we're done and we're doing 6-month follow-up photos, they're like, hey.
You're like, let's go.
Yeah. So
Exactly.
I always think that's good. So then they talk with Kimber.
Yeah.
And, interestingly, many times a lot of our patients who come in for consults, they already actually have a surgery day already booked.
Exactly.
So the meeting with Kimber is more to
dial
in what we are actually going to be doing.
What the surgical plan is.
But at that time with Kimber, she'll go over the quote with you, go over all the fees and scheduling. And then, one of the things we kind of glossed over was being thorough in what we do. Is a lot of times we'll need at minimum some basic lab work, right? So we want to make sure your kidneys are working, you're not anemic. And then for a lot of patients too, they are going to need some medical clearance.
Yeah.
So, if you have chronic illnesses or things that, you go to routinely see a doctor for,
Yeah.
and you go to a surgeon and they don't ask for you to have that, that letter,
That's something to run from for
run.
sure. Yes.
Run.
Take your things and go. Yeah.
Because, turn on the news, Google bad stuff that happens in plastic surgery. And a lot of times it's from people not being thoroughly vetted medically.
Exactly. Yeah.
So tell us how that works. When that comes in, who gets to see when those labs and stuff and those clearances come in?
Sure. So, the clinical team, which right now is myself and Madeline, our nurse, who just passed board. Shout out to Madeline. She's now a nurse practitioner. But basically, we go over all that lab work. So if anything's off or if anything's a little bit funky, you get a phone call from us, and we'll kind of go through all of that with you. And if they're normal, that's awesome. We'll just sign them off. It goes in your chart and we send that over to anesthesia. Same goes for if you see a cardiologist, if you see a nephrologist or anything like that, anything specialty, we always, first off, they have to be aware that you're having surgery. That's the biggest thing I would say. But then also that we get the blessing from them that we're happy and healthy and we're ready to go.
Yeah.
What are some other criteria that you would say are I would say more soft stop and hard stop when it comes to candidacy for surgery.
I think, anybody that's going to have any type of plastic surgery, you kind of need to be at your goal weight.
Yes.
Okay. I don't want to do a really cool surgery, got a great outcome, and then people are like, oh yeah, I'm going to lose another 40 pounds.
Yeah.
And because that can affect your
changes
outcome.
a lot. Yeah.
Or the reverse. I'm going to starve myself, have a cool surgery, then I'm going to go back to where I want to be weight wise.
Right.
And that affects it as well. So
Yeah.
that's one of the biggest things, having a good support system.
Great. Yeah.
And then figuring out post-surgery, what kind of recovery we have, right? Because
Yeah.
someone who's a first responder, firefighter, someone in the police force, law enforcement, it's going to be a lot different
Very
time
different.
period for them to go back to work, depending on what we do,
Exactly.
compared to someone who kind of works from home and can just put a pillow on their lap and put their laptop up and get back to work.
Right. Exactly.
So having those conversations, and I think, again, Kimber goes over a lot of that.
Yeah. And that kind of goes back to when we open the conversation of the consult is we want to get to know who are you? What do you do for work? And how many kids do you have? What's your family like? And all of that.
And how old the kids are, right?
Yes, that's a huge part too. Is do you need help with bath time? Or are we gonna really struggle with the car seats after surgery and things like that? I know another big thing that we kind of touched on with people's weight journeys, because that's a sensitive topic. But something that I know is a big debunk for a consult with us is there's not a certain BMI you have to be in. So I can't state that enough. Is we want you happy and healthy and in a maintainable state.
Yeah.
So you nailed it when you're we don't want you doing some crazy juice cleanse a week before surgery and dropping a ton. Maintain and be healthy, because that's huge on the recovery side as well, and just for you as a person.
Yeah. No, I mean there are some BMI cutoffs for surgery.
Right.
That kind of depends on which surgery center we're using.
But there's not a threshold necessarily that we're you have to be this in order for us to even consult with you. So
and that's happened before where patients have come in. They're like, I've been turned down by 2 surgeons, and I'm like, your body set is this weight. This is you.
Yeah.
We can certainly kind of work with that. I do have a good question for you, because what would you recommend people kind of wear to a consult or bring or kind of prepare?
Yeah, it kind of depends on the surgery you're consulting for. So when it comes to if you have been doing research and you have questions, bring that list with you. Because I know if anyone out there is like me, where if I go to the doctor and I have a million questions in my head, they just leave. So there's a lot of information we go through at your consultation. So it's great to bring a list of your questions or concerns, things that you've heard, or if we're, your second or third opinion, bring the notes from those things. And if you've had surgery before, we love to have, all the information from that too.
Absolutely.
So breast implant cards, if you have op notes and stuff, that's super awesome. We love to see that.
Yeah. I think that's super important. Come prepared. Try to as prepared as you can be. But a lot of times, the thing is, it's okay if you don't know what you need.
Totally.
That's why we went to school for a long time. So we definitely help people kind of do that. So, I mean, but definitely kind of just try to bring as much questions as you can.
Yeah, definitely.
But we'll take you through that journey. And then, again, like we talked about, if after that initial consultation, there's a handful of patients where we'll either have to do a follow-up phone call
Sure.
or virtual or even an in-person.
Yeah.
And I think our in-person consults are really for patients who come in for their surgery and book it for like a year
Yes.
or
Yeah.
10 months down the road. And things may have changed or they just want a reassurance that
Sure.
our plan is good.
Yes.
So I think
Yeah.
that's finally it. And
Yeah.
my kind of last thing to talk about, like with regarding consultations, again, if you don't come with us, which we really hope you
Yeah,
do,
we really do. Yeah.
is kind of red flags to watch out for.
Yes.
Is I think one of the ones is pressured to make a decision that day.
Yes.
And what are some of the ones you think about?
There's a couple that come to mind. I would say definitely the pressure, but also how the staff treats you is huge. Because again, it's a team and you have to like, when it comes to the surgeon that you pick and the team that comes with that surgeon too, you want to be comfortable no matter where like life takes you. And that's something that we really are like take a lot of pride in is like we really try to like make you feel like a part of the family because we're such a tight family. But that's something I would look out for is like, how are you treated? How do you feel at this office too?
Yeah.
And what's the rapport with the surgeon?
And also how the team interacts with
Yes.
each other and the surgeon.
Because that tells you a lot too.
Because you can pick up bad vibes
Yeah.
and things like this.
Yeah.
So I think that's really, really good because we've heard just stories of like, they were so mean to me.
Yeah.
They were rude. You could
like,
tell
it's
that they didn't
hurtful.
respect the surgeon. And so things like that, I think it's really important.
What
But
are some things you would say?
again, I think the biggest thing is just pressure
Yeah.
to like, so like you got to decide now.
Yeah.
Or even like financially, like haggling, like things like that. I think, again, one of the nice things we do is Kimber kind of ahead of time, if we have an idea of what they want, she kind of gives them a ballpark. So they have an idea of what that entails. But
Absolutely.
yeah, the biggest thing is this is a team effort. And I think that thing, and also the other thing, like I talked about in the beginning,
Yeah.
board certification.
certified.
Okay. You can't go see these cosmetic surgeons
No.
who hang a shingle, do surgery in their office or an unaccredited center. And we see it on the news all the time. For the most part, bad things happen when they're done at places that aren't good or by people who shouldn't be doing them.
Right.
So it's one of those things, just do your research.
Yes.
Do your research. We're here to help you. And I think, one of the most important things is that you have to feel comfortable too.
Have to.
If you don't feel comfortable, it's okay.
Yeah, that's all right.
You gotta just vibe.
Yeah.
So that's kind of the biggest thing is just like that you feel comfortable because when you go into a surgery like the ones we do,
Yeah.
you want to be all in and feeling good about it.
Absolutely.
Yeah.
Yeah, I
So,
agree.
All right. Well, I think that's a
Perfect.
pretty good idea of the consultation
Yeah,
process.
it's a good walkthrough.
It is a good walkthrough.
Definitely.
We're going to finish up like we have in our other
Yes.
episodes
Our
in what we
question
call
of
the
the day.
question of the day. And I think Hope's going to surprise me this time.
I am. Yeah,
all
I'm
right.
not going to let you prepare this time.
right.
So, as we've said before, our questions of the day is something we do for fun on clinic days when it's crazy and we just need to take a second and like bond as a team. So, we all tend to have a go-to movie when it's like rainy outside or you're just wanting to like be comforted. What is your go-to movie?
That's a great question because
Yeah.
there's probably two.
Okay.
So, little known fact in the office, I keep kind of a constant loop of like Planet
Yeah,
Earth
always.
or Blue Planet going on because
Yeah.
animals really soothe me. And you don't have to listen to it, but just watching it.
Yeah.
I also, when I do turn the volume up, David Attenborough is the man.
I feel like we should just hire David Attenborough to be a part of our practice now.
He'd be fantastic.
Yeah.
So that kind of relaxes me. But
Yeah.
at home, I'm very predictable. I watch like The Godfather.
Classic.
Because for so many reasons, but it's just shot so well, it's written well, and the acting is superb.
Yeah.
And I always learn something.
Yeah.
So it's a good one to put in the background for me, but it's also one where I sit down and I watch again what Coppola tried to do, and then I kind of nerd out a little bit, and sometimes I'll listen to podcasts or books about the actual making of the movie.
Oh, cool.
And the hurdles they had to overcome, and it makes me appreciate it even more.
Of course.
Because
Yeah.
no one realized that the energy that went into this movie that almost was not made.
Really?
And so we would
Oh, I
not have
didn't
this
know that.
masterpiece. So, and again, but what about you?
I've got two, I think. Go-to is always going to be the Lindsay Lohan Parent Trap. That just does it for me every time. It's so good. It's like with the lizard, it's a classic. And it's funny, it's sweet, but it's very like wholesome. Yeah. I love Martin. Yeah. He's so awesome. And then Father of the Bride.
Oh, yeah.
I mean, Steve Martin Short. That duo is everything to me. Yeah. Oh my gosh, so good.
So just quick story about Father of the Bride. The day my daughter was getting married, the night before, I was alone in the room. I forgot why. Maybe my wife was dealing with some of the other children, and I put it on. I watched it, and I was like, bawling.
No, what a move! Yeah,
bawling.
Oh my gosh, that hurts me just.
But it's a very good movie because it's so real.
Yeah,
and it's like it's true.
It's beautiful.
Everything about it is true, and of course the acting is great, and Steve Martin.
And it's funny, and just like Diane Keaton, you just can't go wrong with the cast.
No. So that's really good.
It's a great relief movie.
All right. Excellent. Awesome. Well, again, what to expect when consulting went great.
Yes, totally.
Again, if you have any questions, you can send them over to info@patrickbasilmd.com. Remember, the Basil has an E on the end. You can send over questions about any of the episodes, also about stuff you want to hear about.
Yeah, we would love to know.
And Hope, thank you.
Yes, thank
Appreciate
you.
Yes.
And
we look forward to the next episode.
Perfect.